Hello, everyone. We're pleased today to have Dr. Andrea Furlan. So Dr. Andrea Furlan is an associate professor at the Physiatry and Pain Medicine Department at the University of Toronto, and she is a pain doctor. She also has a wonderful YouTube channel full of all the information about pain management and chronic pain. So lots of information right there. And today, we will talk about the chronic complication and pain after COVID-19. So welcome, Dr. Furlan, and thanks for joining us.
Thank you so much, Omar. That's a pleasure for me to be here.
Thank you. So let's talk first about the pain complications of COVID-19. So how COVID-19 can cause pain and can worsen the pain that we have.
Yeah, so unfortunately, this virus can do a lot of damage to your body. So I would say there are two phases of how COVID can affect and cause pain. One is in the acute phase. So when it's a viral infection like any other one. So if people get a flu, they get muscle aches, headache, abdominal pain, fever, cough. So all of those things affect our patients who already have pain. And so if someone already lives with chronic pain, like fibromyalgia, low back pain, or a disc disease or some tendinitis, and now they have a viral infection, so that phase is really bad. And I got a lot of people that ask me, will I know if I get a COVID because I'm already taking so many painkillers? How would I know if I have fever? How would I know if I have pain because I'm taking opioids, anti-inflammatories? And I tell them, you will know. You will know. It's like any cold, any flu, any other infection. But they are, their pain that they have, like low back pain, fibromyalgia, is then worse during those days that they have the viral infection, just because they're fighting a virus. And so they're more, their pain is more heightened, more aware of the pain. So that's one thing. Most people, fortunately, they get better from that initial viral infection. 80%, more than 80% of people that get COVID, they clear the virus very well. And now less and less people are getting this because of the vaccines, right? Mm-hmm. But a minority of people that they get the viral infection, if they don't end up in the hospital and the ICU and those complications, and they don't die. But there is a minority of people that those symptoms will not resolve like a normal cold. And that's what we call the long COVID that I think you want to talk today. And for those people that remain, the virus is gone. We know that they don't have the virus anymore in their body, but it's all that reaction of the body to the virus, that inflammation and the reaction of the body also cause some aggression to their own bodies, and that is what can cause the long COVID. So we have had some patients that they have chronic pain, and now months later, weeks, months, or even a year later, they are still having a pain problem. So if they had chronic pain before, in this case of the long COVID, their pain is worse. Or some people that did not have any chronic pain before, but now because of the long COVID, they're having symptoms of all this long COVID syndrome that may include pain.
Yeah, that's interesting. For people who have chronic pain, how could COVID change their pain? Like, is the pain going to get worse? Do they start experiencing new pain in their body or new areas? Or what is the response to treatment after contracting COVID-19? So all those changes.
Yeah. So it's a lot, all of the above, and a lot of things. So it's interesting that you said, will the pain get worse? Yeah, most people that if they get chronic pain and if they get this long COVID, the pain will be worse. However, it's interesting that I have, not my patients, but I've seen at conferences and at courses that I attended, I saw people telling that they got the Pfizer vaccine, they had chronic pain, they took the Pfizer vaccine, and the chronic pain disappeared for a couple of days or weeks. And it was not only one person, it was a couple of different persons. That was a course that I attended from the International Association for the Study of Pain, IASP, and they brought these people to the course to tell us, and nobody knows exactly what's going on. It seems that when your body is making the antibodies, that there is some immunological reaction that blocks the pain sensation. So the basic scientists now are trying to discover how can we stimulate this immune system, because that may be a cure for chronic pain. So we are getting a little bit excited there, but we don't know yet. But not everybody that get the COVID vaccine, the Pfizer vaccine, really get that same sensation. It's not everybody, some cases. Anyway, but the pain came back exactly as before, after 7 days or 14 days after the vaccine. Well, but most people who have chronic pain, and if they develop this long COVID, so their pain, existing pain is worse, but they have new symptoms that aggravate their whole performance. And those new symptoms may not be necessarily pain. They complain of fatigue, poor concentration. So it's a mental and physical fatigue. They can't sleep well. And it's almost like a chronic fatigue syndrome. Chronic fatigue syndrome is another condition that does not have pain. And fibromyalgia is very similar to chronic fatigue syndrome, but it is with pain. Now, the new name for chronic fatigue syndrome is myalgic encephalomyelitis, ME. But and we don't know exactly what causes ME, but it's this profound fatigue. And I have a video in my YouTube channel that I have a video for chronic fatigue syndrome and myalgic encephalomyelitis, because we know this is not just because of COVID. We know ME for many, many years. ME is a condition that we know affects people after a viral infection. And it is like your body's reaction to the virus that cause some changes in the neurological, immunological, endocrinological system. And those symptoms are profound fatigue that does not get better with simple rest. So if you're fatigued because you went walking and you spend the whole day at Disneyland, at the end of the day, you're going to be super tired. But you rest and the next day you are better. With ME, myalgic encephalomyelitis, it's not. So we are thinking that this long COVID is very similar to chronic fatigue syndrome, ME.
Right. Yeah, this is a very frustrating complication after COVID-19. We have seen patients that are marathon runners and really like high competition athletes, and they get COVID-19 and now they're like tired just walking up the stairs. And it's really frustrating how this very fit athletic person became very disabled by this. So this is a real condition, and I'm glad that you made a video. We will link it up in the card for people to watch it. And this is a real condition, and unfortunately COVID-19 is causing that as well. So
one thing that I like to say is because of this fatigue, then they don't have the energy to do what we recommend them to do for chronic pain, which is exercise, meditation, go get distraction. Because people who have chronic pain, especially musculoskeletal chronic pain, the two things that work a lot to maintain their quality of life is regular physical activity. That's why I have a lot of exercise videos in my YouTube channel, and also mindful meditation, mind relaxation, cognitive behavioral therapy. But if you are fatigued the whole day, you don't have energy to get out of, to even go one flight of stairs, you're not going to do your exercise, you're not going to do your meditation, you're not going to do your relaxation. And that's why also the chronic pain starts getting worse. And then people, unfortunately, I think this is a more North American thing, they rely a lot on medications. I think it's easy to pop medications and take a pill. So they come to me and they want a pill. They want a pill that will give them energy. And a lot of times, Omar, it's unbelievable. They come to me and they are taking opioids, antidepressants, because opioids for pain, antidepressants because they are low mood, and then they have a benzodiazepine because they're not sleeping at night, and then they have a stimulant during the day because they're sleepy during the day, and then they have baclofen. I don't know why people give baclofen for pain because it doesn't make any sense. And I say, it's just crazy. The first thing we have to do is de-prescribe, remove a lot of these medications, because all this, the side effects of all of these medications is fatigue, is also dizziness and drowsiness, and it's complicated.
Right. Yeah. It's definitely at the beginning and long COVID symptoms, we usually see the list is long of all the symptoms that the patients are having. And usually I try as well. Like I try not to over medicate every single symptom, because with time, sometimes it just needs a little bit of time to improve. So
Yeah.
I totally agree with you. Kind of like decrease the amount of medication that the patient is taking and focus more on natural things to improve it.
And natural things, these people, diet, sleep hygiene, a good, simple exercise routine, pacing what you are doing, those are things that really work. And they have to be a little patient, that those symptoms will get better. But while they're getting better, do those things. People, eating healthy is one of the major things that I find difficult to change in people. Quit smoking, healthy diet, regular exercise, and sleep. That goes a long way.
Yeah, those are very good points, that if somebody will abide by all of those good advice, I think like significant amount of their pain will get better.
Yeah, yeah.
So what advice and tips would you have for the pain doctor who are dealing with chronic pain, and now on top of that they're dealing with COVID-19 patients coming out with either worse pain or new pain syndromes?
Yeah, so I would say the first thing after COVID is to make sure that they talk to the doctor, so they will be, cleared to see if they don't have any other complication that needs to be treated. Like it could be like an endocrine abnormality, like a thyroid problem. So they need to be checked by a doctor to see if there is no a mild, moderate, or severe depression. So there are ways that we can check, because the person may be feeling low mood. And especially with the pandemic, Omar, a lot of my patients have been isolated. The gyms were closed. They can't visit their friends. They can't socialize. So the mental health burden on these people have been enormous. And because of this, we have seen a lot of people, our own people with chronic pain, that their depressions that were mild and controlled, now they're coming back to us, and it's in the moderate or severe categories. Or their anxieties, they had anxiety problems and it was mild, and now it's moderate or severe. So be checked by a doctor to make sure that they are not having a severe depression, severe anxiety, or they are not abusing medications, because during the pandemic, they might be using more than they were supposed to do. Checking their thyroid, check if they are not having any deficiencies of vitamins, because people may also be deficient. If they are deficient of vitamin B12, a lot of those symptoms will be the same. Actually, I have a video about B12 deficiency and the symptoms, because neuropathies, like tinglings in the hands and numbness in the feet could be vitamin B12 deficiency. And when you have vitamin B12 deficiency, the symptoms also include a lot of other systemic things. And those hypothyroid, all of these things can confuse and be confounding the symptoms. So be checked by a doctor first, make sure that you don't have those things. So if your doctor tells you, these symptoms will go away, you have long COVID, so you had the infection of COVID, and these symptoms that you're having are due to the virus that led to this reaction in your body, they will go away. These symptoms will get better with time. So we need to be a little bit patient. Not everybody will have this long COVID for a year, 2 years later. Some people, a very minority of people may, but a lot of people get better over time. So be patient with yourself, and while you are recovering, do some of those healthy lifestyle changes. This is an opportunity for you to quit smoking. I had a patient, really, I was so proud of him, because during the pandemic, he has chronic pain, he's young, and during the pandemic, he made a commitment. He lost, I think, 40, 50 pounds.
Wow.
Just by dieting, He started, because he wasn't working, he was at home, so he made a commitment. He started walking, and then he started increasing every week the amount of walking that he was doing. And then when I saw him later, he was walking 5 kilometers, which is about 3.5 miles a day.
Wow.
He quit smoking, he lost weight, he was eating healthy, he was exercising. So I think take this as a wake-up call, So you didn't die of COVID, you survived, you're having those symptoms now. Someone is telling you, make some changes in your life, and it's an opportunity for you to go ahead and change it for the better. Quit smoking, improve your sleep, start walking. So for people who have this fatigue and this mental tiredness, the lack of concentration, start walking. It's slow, it doesn't need to be 5 kilometers in the first day. You can start by 100 yards the first week, every day for the first week, and then you increase to 200 and then 300. But make some goals, smart goals. I also have a video about how to set smart goals.
Well, definitely very, very good points. And I believe that, yes, if the patients are consistent, they follow those good points, then they will learn a lot. Well, thank you so much, Dr. Furlan. You had wonderful expertise, and thanks for sharing with us. And please, watching, so you can watch other videos about the long COVID symptoms. And then also you can watch this video from Dr. Furlan's channel to learn more about chronic pain. And see you in the next one.